Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. Thanks again for joining us at Pause for the Truth. Ms. Turner, being the proverbial guest host that she is, will be joining us shortly. Tonight, we have the special pleasure of having Dr. Royce McGowan, my favorite chiropractic physician. And Dr. Royce, how you doing?
Man, I'm good, man. I appreciate that warm introduction, brother.
Well, we appreciate you being here. And we also have the behind the scenes guy that ain't behind the scenes, as we know most of the time. Uh, Sometimes his wife says, put him behind the scenes here. We have Mr. Tyrone Jackson. And Tyrone, how you doing?
I'm doing well. I just remember what someone told me. It's okay to be henpecked. It just depends on the hen doing the pecking.
The hen doing the pecking, right?
I like that.
I agree with that 100%. Tonight is our topic. The topic for the night is most of you guys know. Basically, we're talking about back pain, and that is why it is very concise topic. Is very broad in terms of its what it implies in terms of your health and your well-being. While it may not kill you, you may feel sometimes like you're dying because it can hurt that kind of bad. Okay, I can witness that, as Dr. Royce can tell you, because he's also my chiropractic physician. So, Dr. Royce, what I probably will start out with is tell us what chiropractic is all about. That I am saddened this evening. I have lost a very a good friend, great physician, in terms of whom he's served so many in the Northeast Florida area. My true prayers and thoughts goes out to his spouse. We lost Dr. Bill Cody over the past couple of days to he's passed on to a better place. And I really am saddened by the loss that all of us have in terms of losing Bill Cody. He has been so instrumental in terms of helping out the Northeast Florida Jacksonville community. It didn't make a difference to Bill what kind of what you represented, black, white, blue, green, yellow, as I sometimes say, the rainbow. But he was here to serve all. He was a truly great physician, and he will be well missed. I love Bill for what he stood for, and the actual learning. Believe it or not, I was younger than Bill, even though I looked older than Bill. I love what he helped taught me in terms of how to service my community, and so he will be well missed. And my condolences go out to his family, Betty and Junior, William Cody Jr. So I hope that everything is okay.
Alwyn, a lot of us see commercials about chiropractic care, and to be honest with you and transparent, I have never gone to a chiropractor. You're actually the only one I know. And you may not remember it, but I met you years ago at a networking event. So tell our audience, what is chiropractic care and why do they need you?
Well, chiropractic care, and I'm kind of biased, but everyone needs to go to a chiropractor. And I tell all my patients, you don't even have to hurt to really seek chiropractic care. It is really good for you. What we do basically is align your spine from your neck middle back to your lower back, hips. We even adjust, ankles, wrists. We put vertebra in your spine back in place so that you don't have any nerve interference, and it eases back pain, neck pain, whatever kind of pain that you're having in your spine or any of your joints. We manipulate those joints, and it sounds harsh, but it's not. It's very relaxing. People love it when people say, "Hey, I'm going to the chiropractor to go get cracked." That's what they're talking about. Their
Dr. McGowan is saying, "I'm gonna get cracked." That don't sound very promising or pleasing to me.
That's what so when patients come in, the seasoned patients, and I always tell them, "Hey, don't say cracked. That don't, you ain't gonna, nobody gonna want to come to me. You telling me you right. Stop telling them that. We adjust the spine. So we adjust the spine, and that causes so much. It gives so much relief in whatever areas that we, adjust. But go ahead.
Is your work primarily limited to back care, or is it other parts of the body as well?
Anywhere that you can, where you bend, we can. And what I mean by that, any joint. So we can manipulate. Okay. I manipulate wrists, knees, ankles, but primarily, yes, you're right. 95% of the time, it's the spine. It's the neck, middle back, lower back. Why people come and seek chiropractic care, and we're conservative. I'm not anti-medicine. I just like to. And Dr. Kane knows I have a medical director and I have a nurse practitioner that works in my office. I love the interdisciplinary approach. Where it's both, everybody plays their role, but I like to try to get people. That's why I'll go ahead and get them over to see my medical if I can't get it under control. But I like to try to get them out of pain first without medications, and then go that route if I can't take care of the issue.
So, are most issues that people come to you about related to aging or injury, or both?
You know what? I'm writing a book right now on posture, and it's my belief. I'm doing some research behind it. I know you'll like that, Dr. Kane. You love that research, but it's my opinion right now. I'm doing some research on it that 100% of the time, why people have back pain, neck pain, spine pain, period, is posture. It's posture altogether. It's how we sit, how we drive, how we walk, how we stand, and definitely is how we sleep. Sleep posture plays a huge role in back and neck pain. It's just cute. And just for the, just to let you guys know, the best position for you to sleep is flat on your back.
No, sir.
Yes, ma'am. I'm not going. I believe in it. One step down from God. I don't want to argue on him. I don't mind arguing.
But I will say, let me say this. I'm back. The only thing I say about what Dr. McGowan said a couple of minutes ago was that 100% of the time, he may be correct about 100% of the time when it's non-traumatic. That's the only thing that I might throw in terms of clarity. If it's non-traumatic, meaning hadn't had a fall, hadn't had an accident, stuff like that. 100% of the time, it may be posture. And like he says, he's doing his research on that. As far as sleeping on your back, I'm like JT. Initially, I was like JT, and I'm going like, I'm not a real back sleeper. But over the past couple of weeks, since I've been going to longer than a couple of weeks, but since I've been going to see Dr. McGowan, actually, with the things that he assists me with, I actually feel better when I first get up in the morning if I've been sleeping on my back most of the night. And I have to force myself to do it because my habit is rolling to one side or another. So another. It is a sleeping habit, is that what a lot of us experience. So that's all I can contribute, and that's both. That is especially personal more so than professional.
Well, I'm gonna tell you, Dr. Kane and Dr. McGowan, the reason I say no is because, if to our listeners or viewers, we are transparent on the show, and I have been about different issues. And if you know me, and if you don't know me, I'm about to describe me to our audience, and that is sleeping on the back for some folks whose derriere might be not flattened enough that there's space in between the mattress and the lower back. That is anatomically impossible to
That's
That's
why
sleep
not
they
a
get
black women.
pillows.
That's especially true in black women.
Oh no, now you're right about that. You're right. Behind
Um,
it's a little different. But listen, hold on. Let me say this real quick. You ain't let me finish. You got the people who got them big old behinds. You got to put a pillow in the small of your back.
There you go. I'm in my clinic, but sometimes my patients, they come in and talk about their back pain when they sleep and stuff. I talk about, and with Dr. McGowan you can get into, but I talk about their mattress hygiene, sleeping hygiene in terms of, what they're sleeping on and so on and so on. And I lay them up on the bed and I run my hand when they lay back and lay them flat on their back. I run my hand between the small of their back and my arm can go way over there and touch the wall. See, you're not getting much back support.
Not at all.
So, Dr. McGowan, are you talking about a sleep roll or an actual pillow?
You know what? Just a small pillow, because you don't need a big pillow in the small of your back. But you do gotta. But I'm telling you, what also helps with that, even if you got it behind, is putting them pillows under your knees. You put them pillows under your knees, that's gonna take the pressure off your lower back. You can't just lay flat on your back with your legs out. Yeah, that's agonizing.
Right.
But laying flat on your back, and you also got one of those pillows you use on the airplane. They're great. Put around your neck.
I've been sleeping with it. Love it. It has gotten rid of my neck pain, Dr. McGowan.
It's simple
oh
stuff.
My goodness.
The same thing holds true for the small of your back, because that's what I do. He gave me some, not gave, but, I was able to obtain some from him, some kind of a sleeping arrangement, which I'm going to grab while you guys are discussing further, just to show the audience what it looks like and what we should be looking at sometimes putting up under the small of our back.
So to be clear, and to give a visual, if I'm laying on my back, I shouldn't have other pillows because, again, being transparent, I sleep with the neck roll and the pillows. So you're saying get rid of the pillows and just use the neck rolls?
Yes, ma'am. Yes, ma'am.
And
just
I also put a pillow up under my legs.
Your pillow should only be used for under your legs. And if you want to put them to your side to barricade you so you don't want to turn to you, that's it. Just that pillow, just that. Now I don't even want to call it a pillow. Just it's a cervical collar pillow around your neck and lay with your head flat back so we can get that curve in your neck. All right, and maintain it. That's gonna help. That's gonna help your spine.
Oh, it does me, and I carry mine on the plane. It's just so comforting. Again, it's not all about me. If you're just joining us, we have Dr. Royce McGowan. Dr. McGowan is talking about back pain relief and decompression therapy. I hope we're going to get into that because this is going to be a learning lesson for me. So for those of you who have back pain, or those of you who know others who have back pain, call them in, text them, tell them to join in right now. Dr. Kane is getting ready to do a visual of his own personal experiences. Dr. Kane and I always laugh, Dr. McGowan, about growing older is something else. And his favorite line, but considering the alternative. Okay, so we'll have to make the adaptations. Right. Go ahead, Dr. Kane. What's your show and tell?
All right, so this is one of the kind of a part of the device. Let me just see if I can show it just right. The pillow set. Okay, when you do this thing here with the camera, it's messing up everything.
You're like a magician.
Okay.
Oh yeah, there you go.
Yeah, if you look at it, this kind of is a pillow that got a curve on it. It ain't working as well as. Oh, there we go. It's a pillow got a curve on it and fits up under the small of your back.
Oh.
And it can fit up under the neck. The other one, this is not one that he provides, but this is one that I have that fits right up under my neck between my head and neck. It's got little beads and stuff in it, and it conforms to the curvature of my neck. And this is one other thing that can be used. This other bigger one, in which we are going to take better pictures off camera, off the air, and put it on our website about the whole setup. This kind of helped with the knees and placing it in the right position up under the knees and so on and so on. But it is a very smooth looking device that can.
Is that one of those foam ones, Dr.
Yes,
Kane?
this is foam.
Okay, memory.
and,
Yeah.
and this one is foam, but again, with the curvature up
And that
under.
makes sense. Well, I tell you, just as it seems like it works for you, Dr. Kane, that neck roll has really worked for me because I was having neck issues. But I tell you what, Dr. McGowan, every time, I mean, since I've been sleeping with it, now, according to my hairstylist, it's not doing a lot for the back of the nape of my neck, though, messing up my hair back there. You
Hey,
know,
look. Patients say that all day long. I tell them I don't care about all that. Go to the hairdresser. I'm trying to fix your neck. Which one you want? Your neck fixed or you want your hair fixed? Which one?
it's not about me, Dr. McGowan. It's not about me tonight. Tyrone, I know we've been talking a lot. Tell me about what you've heard from folks about having back pain.
Well, starting off as an athlete, there was a lot of attention to awareness of posture and protection and taking care of the back. So over time, I've been lucky to do a pretty good job with it. I did find it interesting when he said to sleep on your back, and I thought the first thing that came to my mind, that must be for all the Napoleon Bonaparte height people. For us real tall people.
You got to go there, huh?
That poses in it. I didn't say any names.
People that even don't wear glasses can see.
So I would love to have an opportunity to talk about us with taller stature, being 6'6", and though there are additional challenges with the decision to lay on the back versus on the side and things of that nature.
Well, I'm gonna tell you, when you on your reason, it don't matter. I don't care if you're 4'2" or your check height 7'8" or whatever it is. Your back that's it. A spine is a spine. The only way. Listen, we're visual people. Your spine is elongated when you're sleeping on your back. It's open up those discs, and one of the main reasons people hurt why you have back pain. It's not your bones, it's the soft tissue around your bones. It's the discs in between the bones. It's the ligaments, the tendons, the muscle tissue. You're not if you're on your side, number one, everybody does that when they're on their side. I don't care who you are. Then you're gonna crunch up, ball up in that fetal position. Now y'all can't even see me on the TV.
Right.
You in a ball. That's not good for your spine. It's just not good for your spine. Even though you laying in the bed, that's not a good posture. You're creating. Over time, it's going to cause arthritis. It's going to cause problems. Your back is the only way that all that's opened up, and you've been damaging your spine all day long with your bad posture, driving crazy on the computers, on the cell phone, on the laptops, on the tablets. You're tearing your spine. That's the only way your spine can just relax and regenerate at night. But if we don't, and we go on our side or we sleep on our stomach all night, you just further putting more torsion on your spine. And you can't get mad if you got a whole bunch of arthritis at the age 40, 45, 50, years old. So
that's a long time ago. You talking 40, 45. Come on, man. What happened?
I'm trying to get the young
people who, once all these years we've been doing it. So how do we undo it? And I guess you're saying sleep on your back more and with the support.
Man, that's it. You got to sleep flat on your back. That's it. Patients coming to me, I can't do it. And I'm not playing with this. I tell them, I believe in that one step down from God. You got to do. I don't care. Go see Dr. Kane. He'll give you some sleeping pills. You got to lay on your back. I don't care if you got bags on your eyes coming to my office. I'm trying to fix your spine. And if you listen to me, it will work. It takes time because I tell patients, it took you 20, 30, 40, 50, 60, however long it is for you to tear your back up. And they want it done in 5 days, 10 days, whatever. That don't happen all the time. It takes time, but
5 days sound good to me.
I will admit that it was difficult when I started. When he gave me these things and said, "Sleep on your back, sleep on your back." It was not the easiest thing, but then, I got up in the morning. And it's like, hey, I can kind of walk better and. When I first get up, I'm things are better. Now I'm one of those things that, again, as Jocelyn said, Ms. Turner said before, we get very personal. We don't mind sharing our business with people on the broadcast. But I get up and first thing in the morning, you feel like you Uncle Joe, you putting your hand on your hip like, oh Lord, and you trying to straighten up and it takes you a minute. Since I started sleeping on the back and using the pillows to put the particular apparatus up under my leg, I can't get up and do okay. I mean, I got the trauma. I had a traumatic injury. So it's a little bit different because I probably wouldn't have been looking at Dr. McGowan if I hadn't had the traumatic injury because I'm just thinking it's old age. But once I, had the traumatic injury to help overcome that, he started teaching me about the proper sleep hygiene is what I call it. The proper way to sleep. And sleeping on my back, while it was not habitual, it was more habitual for me to sleep on one side or the other, but you tossed and turned all night. Once I started doing it, I definitely noticed the difference.
What about getting up, though, from that position, Dr. McGowan? Do you have to? I know I tend to roll over on my side. If I happen to, anytime I sleep on my back, I roll over on my side to get out of the bed. Is that the best way rather than raising straight up from a flat position?
You know what? Raising up would be better, but if everybody abs ain't there now. I ain't trying to be funny, Miss Miss Turner. I ain't trying to be funny. I'm just, some people ain't got no abs now. So if I don't want you to
abs as an abdominal, right? Abdominal area.
That's right. Sometimes they're not up to par.
Okay.
Yeah, if they ain't up to par, you got the slide and you got the mosey, however way you going, but it's fine. You're not going. My main thing is that you get the length of your sleeping, whether it's 4, 5, 6, 7, 8, 9, 10 hours a night, is flat on your back. You're not gonna do anything bad to yourself trying to get out of the,
Well, Ms. Turner, before you say anything, let me just at least say this part, because that's one of the other things I've noticed. You've heard the phrase that the manufacturer of the mattresses say 8 is late or something like that. If it's over 8 years old, you need a new mattress. Some of the mattresses don't make it a whole 8 years, but a lot of people have these mattresses that dip, and when it dips, if you ain't got the proper support, you gonna dip, and that's just as whether you land on your back or your side, you're not getting the proper support. I'm not like my wife who has that. I can slide my hand between a upper back and her buttocks, as they say. I can slide, man. I'm not like that. However, if I don't have a good mattress, you're gonna be miserable, and I don't care what kind of additives or whatever you want to call it. I don't care what you do as it relates to trying to get that proper support up under your back. If your mattress is already given away and you don't have a nice mattress, then whatever suits your fancy. I don't know if Dr. McGowan has particular types of mattresses that he represents, like, whether it's Sleep Number or whatever it may be.
Dr. Kane, we're going to pause. Yeah, Dr. Kane, before Dr. McGowan talks about that, we're going to pause for a moment for our history maker moment. Every week before we pause for the truth and share some information about a history maker in our in the midst of all that's happening. So Tyrone, take it away, and we'll get back with you, Dr. McGowan.
Hello and welcome to Pause for the Truth's History Makers Minute, December 5th, 2023. As we pause to reflect on the past and present, it's vital to acknowledge the individuals who've made monumental contributions to America and the world. Today, we acknowledge Dr. J.R. Gladden, who was born on October 29, 1911. James Robert Gladden was born on October 29, 1911, in Charlotte, North Carolina. He was the son of James Albert and Luwaco Gladden and graduated from the Long Island University class in 1936, where he played varsity basketball and was captain of the varsity tennis team. After attending Long Island University, he attended Meharry Medical College. He received his M.D. degree magna cum laude and earned the Andrew Nelson Award for the highest four-year grade point average. In 1943, due to the efforts of Dr. Julius Nevieser, Freedmen's Hospital, affiliated with Howard University, became the only institution in the country where African Americans could routinely obtain approved training. The program provided an orthopedic experience for general surgical residents who rotated through the service, but was primarily designed for the training of orthopedic residents. Dr. J. Robert Gladden became the first full-time orthopedic resident at Howard University. Dr. Gladden continued to pioneer in the specialty and in 1949 became the first African American certified by the American Board of Orthopedic Surgery and the first of his race elected to the American Academy of Orthopedic Surgeons. In 1950, Dr. J. Robert Gladden was appointed clinical assistant professor and chief of the Division of Orthopedics. Many men received all or part of their training in the program during the next decade. Dr. Gladden became the first African American to be elected a Fellow of the American College of Surgeons in 1951, and in 1956, he became the first non-white physician to perform a major surgery at King Edward VII Memorial Hospital in Hamilton, Bermuda. In 1959, he was honored with the Tristram Walker Metcalf Award by Long Island University for his dedicated service to society. During his life, he was chief of orthopedic surgery at the Howard University School of Medicine and Freedmen's Hospital and one of 3 chiefs of orthopedic surgery at District General Hospital. Aside from Howard, he lectured at George Washington Medical School and was affiliated with numerous hospitals in the greater Washington area. He was chairman of the orthopedic section of the National Medical Association, held numerous other posts of leadership in his profession, and contributed frequently to professional journals. Dr. Gladden spent his leisure time fishing on the Chesapeake Bay and often in the Bahamas for white and blue marlin. He died on December 8, 1969, at the age of 58.
Wow, what an esteemed career.
And
to die so
58.
young. And to die so young. You know, many times people are busy taking care of others while unfortunately neglecting their own health. We don't know that obviously with the doctor. However, it makes you wonder. If you're just joining us, we're talking about back pain, and it has been very entertaining. If you are just joining us, you missed the first 30 minutes. You go back and listen to the great tips that Dr. McGowan has been sharing with us. So Dr. McGowan, you also mentioned, in addition to back pain, people come to you with wrist, wherever there's a joint is what you said.
Yes, ma'am.
Do you find that most people who come to you are older people or younger people, or working people who are still working maybe on jobs or doing things? You know, guys, for whatever reason, like to go up under cars, climb up on ladders, do all sorts of things, playing sports.
Stupid stuff. Go ahead.
That men tend to be your main clients, or tell me about who your clients typically are.
You know, it's a wide range, but mostly I would say women take better care of themselves than men. Honestly, Dr. Kane, you can attest to that. I mean, they'll come now. My men that come in, they usually they women dragging them in. He ain't no good, doc. You just got, he been trying to do it he been trying to do this and that, and he pitiful.
He all broke down.
And we bad. And look, I'm a doctor and I'm included. My wife had to drag me to the country. But yeah, mainly it's a wide array of different ages. You know, I've got some 90-year-old. I got a gentleman I treat that's 95 years old. Man, he looked like he's 60. And I've got 3, 4, 5, 6-year-olds that come in the office. But mainly it's working class people. They trying to get back on the job, and they trying to take care of the issue at hand. They may be tired of taking medications for it, and it keeps coming back. They may be went through physical therapy, and it keeps popping up on them. And but it's a wide array of different people that have different ailments, and in different. You asked the question about the different. It's not just the spine. A lot of times people come in. And Dr. Kane, you'll attest to this. A lot of times people come in to me with shoulder pain.
Yep.
But it's not their shoulder, it's their neck. the nerves in your neck go into your shoulder and your arm.
Yeah.
So it's like it's hard to try to explain that to people. But the way I explain it to them, and the same thing with your back. Like people have sciatica, they'll come in and they, oh, doc, it ain't my back. It's my butt, my leg. Yeah. And I try. It's not your butt and your leg. It's your back. After we do an examination. So your neck, the nerves come out your neck. They go down your shoulders, down your arms to your fingertips. You also got nerves that go up and go to your head. Okay. Now you also got nerves in your back. They go down your butt, down your legs to your feet and toes. So if something out of whack in your back, it can send stuff down your butt and legs, feet, toes. If something out of whack in your neck, it can send stuff down to your shoulders, arms, fingertips, or it can cause consistent headaches. If
cause headaches. Yep.
So I'll it's in the way I explain it to patients is imagine you have a hose spigot and you got a hose, turn it on full blast, the water's running full blast out of the hose, and then you put a kink way up by the spigot, put a kink in it. You can beat that hose to the cows come home. You can massage it. You can do whatever you want to that hose. Ain't nothing gonna happen. That water's not gonna come until you take that kink out of that hose up there by the spigot. The energy is not gonna flow through it, and that's kind of what happens. You have a kink in your neck, it's gonna send that stuff into your shoulder, down your arms. And same thing, if it's in your back, it's gonna send it down your butt and legs. Go ahead. I'm sorry.
What's the typical? What's the typical amount of time do you spend with a patient to get them? And I'm not an expert in this, so forgive me if I say it wrong, but in order to get them realigned, if you will, that to say that, ma'am, sir, you've done great. I've been working with you a couple of years now. You're in alignment. Or once people start coming to you, are they going to always have to come to you?
It matters. It's no, they once they need to come in. And you know what? The way I explain that to people is, when you trying to get let's say you want to get a 6-pack. And you start eating right and all that. You go to the gym and all of a sudden you get the 6-pack. When you get the 6-pack, do you say, okay, I got it now. I ain't got to come to the gym no more and I can eat donuts for the rest of my life? No, you got to maintain it. So yeah, you got to, with anything, you got to maintain. There ain't nothing that you just get one and done and that's it. I ain't gonna. So to answer that question, because people have that adage about chiropractic, oh, you got to go for the rest of your life. You don't eat one meal and that's it. You got to continually eat every day. I mean, there's certain stuff you got to do when you're trying to make.
No, Dr. McGowan, you have it wrong. You need to say you go to the barbershop and the hair salon and the nail salon regularly. So just add me to the list.
Right. You're right. I will do that. I like
that. Maintenance is important.
It is. You
don't take a car to get the oil change one time.
Thank you. And I use the car all the time. We don't wait for black smoke to come out the hood and tires to be bald and you sliding all across the street for we to go get our cars taken care of. We go get that little sticker the little man put in the window. Ain't nothing wrong with the car. And we take it in and get it taken care of without no issue. But with our backs and with our necks and with our health, doc, this is what I do, and I tell patients that with the diabetes y'all got, with the high blood pressure, with all this other stuff y'all got, y'all wait for the black smoke to come out of your body before you go get it checked on.
The relationship with diabetes. Relationship with diabetes, high blood pressure, and stuff like that. If we can't get the exercise in, which I will not be doing if I can't, my back can't support it, if my ankle joints can't support it, my exercise. Knees, wrist, whatever it may be. If you don't get that in, then you're really not going to be able to get that back in a better state. So or vice versa. That back, if it's preventing you from being able to do the exercise, then your diabetes and your high blood pressure is not going to get any better without the proper diet and exercise.
That's right.
And people are, they will take care of the car, the house, but when it comes to, and their nails and hair, but when it comes to their physical health, I don't know why they don't seem to treat that as meticulously as they do other aspects of their life. Or either they'll say, oh, Dr. Kane, Dr. McGowan, they take too long when you go there, but we'll sit in a hair salon or a nail salon for hours, right? I mean, it blows me away, Dr. McGowan and Dr. Kane. I just really don't get it. If you're just tuning in, we're talking about back pain. It's something that far too many people have experienced issues with. Many of us sit at our desk, Dr. McGowan. We sit in front of a tablet or a computer. Then after a while, we start feeling our neck, we start rolling our neck and And so, what advice can you give to people as they're sitting at their desk or sitting in front of a computer, or if they have that type of job, maybe they're answering the phone?
Great question. And I tell people this every day. Raise your monitor as high as it can go. I know nobody can do this. Somebody gonna do it one day. But if you can put the monitor on the ceiling, that'd be the best for you. You can have that neck. Once again, we always want that curve. We want that curve in the neck. So, yeah, the more you, because think about it. You can't hump your back and look up. You got to work at it. Now, if you're gonna be ignorant and hump your back and look up, you got to be actually work at that. But it's gonna make you get your chest out, good posture, and it's gonna make you, it's gonna open that spine up. So raise that monitor as high as it can go and drop your chair as low as it can go. That's gonna help you. So you're looking up and it's gonna help your spine.
And we tend to do the opposite, Dr. McGowan.
That's what he's saying.
Yep. We do the opposite.
You gotta look at the ergodynamics of being able to sit properly. The ergodynamics, Bill Clinton made that word popular back when he was doing the whole ergodynamics of workspace. But you got to get the right ergodynamics when you're sitting at work. And especially these days, believe it or not, I mean, it was bad when people went to the office to work, because maybe they did go and get some lunch or stuff, they got up and get a break and yada, yada, yada. But a lot of people are working from home these days, and they don't have the proper ergodynamically, the proper chair or furniture by which to work. And they're working very uncomfortable at home. And because they're not ready to spend the money themselves for themselves. And where at work, they were legally, a lot of the offices were forced to provide ergodynamic friendly furniture, for lack of a better description, ergodynamically friendly furniture to be able to accommodate those employees. But when we at home, since COVID and the rest of that, we're not really sitting in the proper environment or using the proper furniture by which to do what Dr. McGowan said.
And that's one of the things. That's one of the things that I see all the time in my business. As I've watched people after a pandemic move from the working situation where they would tell the boss, "Oh, I have to have a larger screen. I have to have more a certain kind of chair." They moved home to a laptop on a table, on a kitchen table. They threw all ergonomics out of the window when they had to pay for it. And when they were at the working place, they almost cried a hissy fit in order to make sure that they got it.
Y'all preaching. Because I fussing with people all day. I had a patient last week that person make great money. They at home now. Their workstation is a dining room chair with a doggone what you call it, the tables that you eat on when you watch the TV table, laptop on it,
right?
And complain about, well, my job, they gonna pay for this, and I wrote the letter up, but I said you need to go buy a chair and you need to go in your office, but to be comfortable and watch TV while they're doing it. And I said you got to sacrifice some stuff, man. You got to do it. This your body. It's amazing. Like you said, Ms. Turner, how the priorities people have. It's like, we talk about cars, but our bodies are 90 billion times more important than a car. I don't care if you got a Rolls Royce. It's a car. But we'll take better care of that than our doggone body. We won't spend no money on our body, but go spend no matter what the bill is. Go ahead, take care of it.
You can change jobs, but you can't. You can change jobs, but you can't change bodies. So you better take care of what you can change.
Thank you.
I have Dr. McGowan. I have a bad habit. When I come home, I like getting in my recliner. I know I'm not the only one. So it sounds like I need to get rid of my recliner. I mean, I'm just trying to say, you just taking away all of my.
I ain't saying you can't take. Just don't go to sleep in. And when
Oh,
people
I don't do that. No.
look, you say we be real on here now. When people act ignorant and they want to go to sleep with a thing, that's when I get an issue. Okay, you can lay in and watch your little TV, and just like them prismatic beds and all that. I got a pet peeve with them too. They all right, but watch TV with them all bent up like that. When it's time to go to sleep, lay that thing flat and put those pillows under your legs, like I told you, because the dynamics when you got it all bent up, it's not good for your spine and all that stuff. It's different when you.
Mr. Turner, before we get too far, we need to go on ahead and start talking about decompression therapy.
Okay. All right. So this decompression, we have non-surgical disc decompression machines in our office, and what they do.
Explain what it is first, Dr. McGowan.
Okay, they provide it's a machine that basically for the lumbar spine. We have machines for your lumbar spine. We have it for your neck. And what it does is let's explain the lower back first. If you have herniated bulging disc, you got pain going down your butt, legs, feet, toes. We have a machine that we harness your lower body in, and then we strap the top part of your body, and basically it creates a negative pressure. It pulls in opposite directions, and it opens up the disc space, takes the pressure off the disc so it can suck back in and actually heal naturally. It takes time, but it's a very effective tool. It's got an 88 to 92% success rate. I will say this: I've had probably about 60% of my patients, their first 3, 4, 5 treatments, they feel great. Some people, they have to go through the whole treatment process and they actually start feeling better afterwards. But it is phenomenal. It takes the pressure off that disc, it allows it to heal, and allows the body to start doing what it's supposed to. So, and then that's the lower back. Now the neck, it's another machine that harnesses your head in it. You're laying back on it, strap your head in, and same thing. It tractions your neck up, it opens up that disc space, creates a negative pressure in there, and it allows that disc to start healing. We have to see an MRI first so I can see exactly which level, because the machine, we put the exact level into it, and then it pulls that level and it starts providing relief.
Sounds like you work hand in hand though with the medical doctor as well, Dr. McGowan. You mentioned the MRI. So people, you're not a replacement. You're a part of the individual's medical team. And that's the thing that people have to realize. You go to your primary care physician like Dr. Kane, and for ladies, we'll go to an OBGYN and whatever. So people have to realize you need a healthcare team in order to help you manage your care. Wouldn't you say?
Yes, ma'am. Definitely. And like I said, I always communicate with my primary cares of the patient, especially if there's any type of issue, or if the patient needs pain medication. I'm not, because they're like, sometimes some patients like, I know you're a chiropractor, doc, you ain't gonna, and I tell them, I'm like, look, I got a medical director. I don't want you in pain. Let's ease the pain. Let's get you out of pain. Take the medication, especially in the beginning. But the goal is to get you off that stuff so you ain't got to take that stuff for the rest, because it's not curing anything. It's just helping you feel better right now. So I want you to feel better right now, but let's take care of the cause of the issue, so you don't have to so you won't even need me or need the medications at one point. Start taking care of yourself.
Does insurance cover your chiropractic care, Dr. McGowan?
Yes, ma'am. Insurance does cover chiropractic care and the therapy that we provide. It doesn't cover decompression, but we have a bunch of different payment packages and all that stuff. We always talk to patients about that.
Okay.
Yes, ma'am.
Well, decompression, let me just say this. A lot of times, whenever we get ready when things new come to the market, and insurers are all about trying to just save money more so than save patients.
Right.
Okay. And do what makes patients feels better. It may take them a while before they sign on and sign in to the kind of care, the innovative, the new things that come about that we're not familiar with. Over time, they do sometimes go ahead and assimilate and agree to go ahead and take care of that. So I think decompression therapy, Dr. McGowan, you can straighten me out if I'm incorrect. Decompression therapy, in terms of a timeline, is relatively new to the industry. Relatively.
Yeah, because VaxD came out, I think around 1981 or something like that. Right. And then, like the machine I have, the people who invented the VaxD, they actually, they did research, because VaxD used to lay on your stomach and it pulled you back. They did all this research and they learned supine, which is laying on your spine, laying on your back. is the best way to decompress the spine. So they reconfigured the table and did all that stuff. And yeah, it's been around, maybe like 30, 40 years. Yeah, it's relatively new. But it's like I said, it's got a great success rate so far. And hopefully, my thing is, this is my thing. I'm a conservative physician. That's why I became a chiropractor. I would, and I've had patients. I will be the first to. I want people to get better, and I've had patients that have still had to have surgery, even though they've came to me. But my thing is, try this first. 88 to 92% of them don't have to, but there's a percentage of the people that can. And I don't have an ego. It's like, hey, this didn't work. Let's go to the next step. But at least you tried it. And most people tried and it works, so they didn't have to go that step with having surgery and all that stuff. But if you can, I think that everyone that has, especially debilitating back pain, because back pain will scare you. If you've never had it and it pops out of the blue, it will make you. It don't matter. You cut me, give me surgery. Where's the Lord at? Just whatever. You can't function if your back go out on you. I'm telling you. So it's like, I think everyone, in my opinion, should go through decompression therapy first. It's not gonna hurt you. That's the thing. It ain't gonna hurt you if it ain't gonna. Even if it don't help you, it's not gonna hurt you. So if we'll see if it works. If it don't work, hey, let's go to the next step.
Well, I will say, and I'm sorry, Josh, go ahead.
No, you go ahead.
I will say, when I tell people about decompression therapy, my analogy is like a marshmallow vanilla wafer cookie. You got the cookie and you got the marshmallow in the middle. And when you first take them out the box, they're nice and fresh. So when you're born, your disc, or you can push on that marshmallow and it bounce right back. As you get old and dried up, the marshmallow start to dry. You can't put it back into place as easily, or put back into place as easily as it was when you were much younger. So decompression therapy kind of takes that marshmallow vanilla wafer cookie, pull on the cookie, so to speak, to allow that marshmallow to go back in between the two cookies in its proper perspective.
Well, I tell you, you had me at 88 to 92%. I wish I could get those kind of odds on the lotto.
How about 0.00000?
88 to 92, boy, you could sell a lot more lottery tickets if that was the odds.
Yeah.
That you could get. So that right there is a very much a winning concept. If you're going to try something and it has that type of success rate, all kidding aside, who wouldn't want to have a better opportunity? Because though a lot of surgeries have been made routine and they continue to get better, there's always a risk in any surgery. Right. And it's higher than, and it can depend on the surgery, but it can be very well, very high indeed.
And not all surgeries have a great outcome. I mean, I will say, I'm one of the first to admit, as being a medical physician, that use the whole traditional medicinal therapy, that not all surgeries turn out well. You got scar tissues that created. The things have gotten better as time went on, just like with chiropractic treatment. Things have gotten better over the years, which in which we got more knowledge as we proceed to interject into society and interject into the medical community, new therapies, new ideas and stuff. Things have gotten better, but not all surgery turns out that well for everybody. So there's a percentage of that has a certain failure rate. And I'm not anti any of it. I just want whatever works best for my patient, whatever will work for my patients in the safest means that it'll work for them, I'm all for
it.
Yeah, Dr. McGowan, you gave some. Go ahead. I'm sorry.
Can I say this one last thing? Another thing that I really preach to patients is, and they don't want to hear this a lot of times, especially when they're in pain, motion is lotion. You got to move. A lot of times people, they get some type of injury, and I'm real graphic with patients just so they can see stuff. You get injured, you have some type of trauma, and then people don't want to move. And that's how you end up dying, honestly. You don't want to move. Now you're sitting there, Now you know I'm big on posture. Your posture getting worse and worse because you know, and then you don't want to do, you don't want to move. Once you start getting that arthritis and that stuff start getting riddled throughout your spine, you don't really want to move. And inactivity makes it worse. Inactivity makes arthritis worse. You gotta move. That's one of the main things with arthritis, man, that combats it is activity and motion, even though you're hurting. So all y'all listen out there, move as much as you can, even though you're hurting. I ain't trying to tell you to go kill yourself. Don't go bungee jumping, do nothing stupid. But you gotta move, get up, go walking, get to the gym. I just got my mom back in the gym. She's 75 and she getting there. I got her back in the gym. She getting in the sauna, and I'm making it a routine for her. She was going like 2 days a week. I said, Mom, you ain't got nothing to do. Why you don't go every day?
Right.
You know what I'm saying? She's like,
hey, look at bungee jumping may actually help. It may.
So, Dr. McGowan, we talked about chiropractic care and decompression therapy. Tell us what other resources or services you offer at your practice, and tell our audience the name of your practice.
The name of my practice is McGowan Spinal Rehabilitation Center, and we have a wide array. We have chiropractic care, of course. We have EMS machines, which are electrical muscle stimulation, which helps increase the blood flow to the muscles. We have ultrasound machines, which does the same thing, except it's a little deeper. So people who have injuries that are a little bit deeper than just muscular, we put them on the ultrasound machines. We have this new machine that I just got maybe about 6 months ago. I love it. It's called a shockwave therapy machine. It has sound waves in it that breaks up scar tissue. So people who have those shoulders and even the back and the spine, which I mainly specialize in, but shoulders and those joints and knees, we have the shockwave therapy machine that works excellent. We have we have a fat loss laser in our clinic that also breaks down. It increases.
Sign me up.
I actually experienced. I can tell you, I experienced the shockwave, and I did feel somewhat different after just one treatment. I could tell the difference.
I love that shockwave. The shockwave
I love it
machine
too.
is the bomb, man.
Look, it's a little funny feeling, I guess. But
so Dr. McGowan, you said something though that sparked my interest. You talked about for scar tissue buildup. So I had knee surgery and knee replacement, and I was pitiful on my therapy. So the scar tissue is built up, so my range of motion is poor. Does that mean I can come to you and you can help break up some of that scar tissue in my knee?
Definitely, yes, ma'am.
Without damaging my mechanical knee?
I'm not going to damage it, no, ma'am. And I have a knee decompression machine too. So it's a total different machine that decompresses your knee and opens up the disc and allows the meniscus to heal. If you have any type of ligament damage, it's not contraindicated for you to get on that. I have to do an exam on you, but that machine works well along with the shockwave therapy machine. So
that sounds dangerous. I can't. That sounds painful.
It sounds bad.
No, it's not. It's not. I did it. I know it's not dangerous, and it does not hurt.
Wow. Well, Dr. McGowan, we learned a lot from you. We're at the end of the show. Was hoping your wife would be able to join us, the other Dr. McGowan, but hopefully she will join us on another show. But I think our audience, I think you enlightened us a lot. You told us to move all those cute pillows from up under us and learn to sleep on our back and put a little small pillow between on the curvature of your back and a pillow up under your legs. So I'll let you give the final thoughts and some of those tips, if you can tell our audience those final tips as we wrap up tonight's podcast.
Make sure you're sleeping flat on your back. Put that pillow around your neck that you use on the airplane, and put a couple pillows up under your knees. That's it. If you got it behind, put one in a little small pillow in the small of your back. Lay flat on your back. That's it. Make sure you're drinking plenty of water, because your body is made about 50 to 60% of water. The more water you drink, the better off anything. Just like you was talking about those marshmallows, those things made a ton of water.
And they dry up. And they tend to dry up.
Yeah, that's what you kept saying, being old and dried up. I ain't agreeing with you. But we want to get undried up. So drink that water and then.
Thank you, Dr. McGowan. Thank you so much. We really appreciate your tips. And Dr. Kane, what are your final thoughts for tonight's show?
I will say the safe options to doing things in terms of treatment. You have to be very innovative in terms. Medicine is being innovative. We come out with new stuff all the time. Whether it is a medical approach, medicinal, traditional medicinal approach to things versus chiropractic approach to things. Be thoughtful. Listen to what Dr. McGowan told you in terms of trying to do better for your own health in terms of your exercise, your hygiene, sleep hygiene. I call it sleep hygiene in terms of how you sleep, in terms of using things as simple as pillows up under your backs, up under your back. Physical therapy is great, but in addition to physical therapy, you can also look at doing some things that have not been so traditional in medicine, and look at chiropractic medicine, because it can make a huge difference in terms of what your improvement is, and do you need to do surgery versus not doing surgery. Think about your care and being global and include both chiropractic and orthopedic and or other medicinal approaches to your care. Interdisciplinary, meaning you looking at the disciplines of chiropractor, of medicine, of orthopedics, looking at those different disciplines and seeing how they approach to your care is the best way for your, and helping to decide, being educated on all three aspects is the best way to take care of yourself.
Thank you, Dr. Kane. And as you can see, our behind the scenes guy came to the forefront. Tyrone, what are your final thoughts regarding tonight's topic as a man of a particular stature?
Thank you very much.
That's what you're trying to say, a tall guy versus a short guy?
Well, let me start by saying that with everyone, there are challenges, and being tall has its challenges. I remember when I bought the desk that I have, and it's a desk that I can raise up, because most desks are very low. And my wife like, you're going to spend all that money on the desk and all the raise, can you put it on bricks? I said, no, baby. I need for my monitors to be high so I can look straight on to them. There's some really important things that I heard from Dr. McGowan, and that was simply that the ideal and the concept of chiropractic as a whole, and his approach it's not very aggressive, but you're working with the odds. 88 to 92% of the time, this is going to save you operation. It's going to save you pain. It's going to make life easier. It's going to make it possible for you to do things that are proven to make you healthy over time. One, it's going to make it more possible for you to move and be fluent and do things and get up and get involved. He's advised us that we always do to drink water and stay hydrated. So what I really like about the whole concept is that this is a global concept. I heard Dr. Kane say that, and this is only one piece of it. Make sure you have someone who's working for the whole body and not just for a part of it.
Thank you, Tyrone. Again, if you missed the show and you have back issues, or if you don't want to have back issues, make sure you look at the rebroadcast, because Dr. McGowan gave us some good tips and, things that most of us, again, when we sit in front of the laptop, we don't have it up high, and mine right now is not up high enough. So when I finish the podcast, I'm doing my neck, rolling it, trying to get it realigned. But if you have never been to a chiropractor, as I never have, I tell you what, listening to Dr. McGowan and the things that he said tonight, sign me up soon so that I can get this old girl back into alignment. For those of you who tune in to us every week, we really appreciate it. Join us next week as we have another topic that is of importance to you and or your loved ones. Thank you, Dr. McGowan, for joining us. Have a good evening, everyone.
Welcome to Pause for the Truth. We are grateful that you joined us today and hope you've gained valuable insights on our current topic. We look forward to having you with us next time as we explore trending issues in our community and discover ways to simplify life for you and your loved ones. Our dedicated panelists and staff are committed to sharing knowledge and serving our community. But now, we need your support. Please subscribe to our YouTube channel and spread this valuable knowledge to others. Don't forget to invite your family and friends to tune in to our podcast every Tuesday at 6:30 p.m. EST. Visit our website at www.pauseforthetruth.com and show your support by liking us on Facebook, following us on Twitter, and linking with us on LinkedIn. Feel free to email us with any questions, or concerns, or show topic recommendations at info@pauseforthetruth.com. I would also like to give thanks to our behind-the-scenes technology engineer, Tyrone Jackson,